A finger prick test has been developed which patients can use at home and which checks the health of your heart in just 9 minutes.
Test which posts the results straight to your GP via the NHS app has taken more than 2 years to develop. After being trialled in 5 NHS areas, it's now due to be rolled out across England. Our health correspondent Nikki Fox has this report.
Jason Wilson is a receptionist. He wanted to check how healthy he was, so he got involved in the trial. Since he took the test, he's lost 2 stone and is feeling good about the changes he's made.
It showed that I was categorised as obese, which was a bit of a shock, and it made me realise I need to make some long-term changes to my health to improve. So now I run 30 to 40 minutes, either on my treadmill or around the park here. I've started drinking a lot more water. I try not to eat anything after 8 o'clock, and I've just tried to be a bit healthier. Yeah, it's made a big impact.
So who could be given one of these tests?
The first are the 40 to 74-year-olds, which is the age group that traditionally qualifies for the NHS Health Check. However, there's a much wider group of individuals, potentially starting even as young as 18, who are at higher risk of cardiovascular disease, and we're also targeting that group as well.
So how does the test work?
So I prick my finger and then put a droplet of blood on there. It's about 100 times less blood than's required if you go to the GP and they take blood out of your arm. What we're going to do now is start the timer.
You wait 7 minutes.
So as you can hear, that's the alarm.
Then use the camera on your phone or iPad to take a picture. It analyses the colours on the test. After a few more seconds, the results are through.
If any of my values were unhealthy, we would flag that as red. Now, my official NHS heart age is actually the age that I am, which is good. And my blood test values are all in the healthy range.
The results will go straight to your GP via the NHS app. It took more than 2 years to develop, talking to doctors and patients. Most of the test is even produced here.
We know how stretched the NHS is and the post-COVID backlog. The technology like this is a way of preventing long-term conditions. If we know about those early, we can intervene and we can identify those at-risk people in our population.
The test and app has been trialled in 5 NHS areas across England and will now be rolled out across the country. For Jason, it's helped him take control of his own health. Nikki Fox, BBC News.